So I'd like to welcome everybody to this afternoon's webinar. We're very fortunate and grateful to be joined by Dr. Marina de Koning-Tijssen from the Netherlands. She is the head of neurology at the University in Groningen there, and is a significant researcher in the area. And what I'd like to do first of all is to say welcome, Marina, and just ask you a little bit about your research, where your focus actually is, and what the last 12 months has meant to you.
Well, thank you very much for inviting me. It's a pleasure to be part of this. Well, as you said, I'm a neurologist and I'm mainly doing movement disorders, so involuntary movements. And I'm seeing also a lot of patients with functional movement disorders. And my research is mainly focused in general on how do people look like, what we in neurology call what's the phenotype, what are the characteristics of patients, what kind of features do they have, and I'm mainly interested in patients who have jerky movements or tremorous movements. And besides that, I'm doing a bit of genetic research, and also I measure these involuntary movements with things like EMG. And in addition to that, we have done some treatment studies in patients with functional movement disorder. So this is more sort of a wrap up of all the things I've done over the last years, and especially also over the last 12 months. And we have just finished 2 big studies for treatment in functional movement disorders. There is one that we did with the website of John Stone. Most of you probably know that website with a lot of information. And we made a specific one based on that one, with also with illustrations and cartoons and information. And we did a large trial in 200 patients, and half of them were provided this website and half of them not. And we want to see if that helps them in improving their symptoms and quality of life. And the other trial we have just finished is that we did in patients with specifically jerky movements. We treated them with botulinum toxin in a randomized controlled trial, and we looked if we could improve their symptoms, and many of them improved, but we have to find out if it was based on botulinum toxin or placebo, or what's the difference, and we are very anxious to find out those results.
Okay.
Yep.
That's great. I've just had a comment. If you can just sit back a little bit from the microphone, because it was just getting a bit loud.
Okay.
That would be great. And for anybody that's wondering where is Marina, you can't see her face. We had some technical difficulty with the video, so we don't get the delight of seeing Marina in person face to face. We just get to listen to her voice. So apologies for that, but we just want to get started as soon as we possibly can. Just as well for people, please ask questions, fire your questions in via the chat or use the Q&A button. For those of you watching this on Facebook, again, just ask your questions in the comments and we'll pick them up that way. A question to you, just following on from the type of research that you're looking into. Are you seeing the distinction between organic and functional disorders, particularly in relation to things like the tremors and the jerking that you're seeing? Is that a distinction that is still worth making these days, or because obviously the symptoms are still the same?
Yeah.
From a research perspective, is that showing any differences?
Well, that's a tough question, actually. I think it does. I think there has been quite some studies now showing that we should look for specific positive symptoms that fit with functional movement disorder, so that discriminates them from other movement disorders. But we have done studies on that, showing a lot of experts videos from both functional and non-functional patients. And then it appeared that it's quite difficult actually to have them all having the same opinion opinion on it. So it's not as easy as we think it is. But I do think there are some clues that you can also show patients themselves. What are the differences, like positive signs that if you do something else at the same time, that the tremor gets less, and if you do it in an automatic way, that it's getting easier than when you really focus on it. So those are features that help you to discriminate functional like tremor and other tremors.
Yeah, yeah. And you also touched on genetics.
Yeah.
And I know that a lot of people that suffer from FND have this question: is this hereditary? Could this be in the family? Could my sister or my brother also suffer from this? If I have children, will they be affected by that? What's the finding so far in your research?
Well, I think until now there have been some familiar cases described, but not many, and there haven't been found any genetic background for it. So I would say at this moment, if someone asked me, is this an hereditary disorder, I would say, based on what we know until now, I don't think so.
Okay.
Yeah.
But as you said, there's probably a lot further to do with the research. But that's interesting, isn't it? I know that that people are looking at that and worrying about it at this stage.
Yeah.
We need more evidence, really. I guess is the answer on that one.
Yeah.
And obviously you're in the Netherlands.
Yeah.
Today is an international day, and we're very keen to understand from each of the countries how people are best supported. And everyone that we speak to always faces the same challenges. There's not enough money for research, very difficult to get the support services in place. But from the point of view of our participants from the Netherlands, what's the situation like in the country?
Well, I think there is an increasing awareness for functional neurological disorders. And there is quite some research done as well. We have here at Groningen, there is also a professor in of psychology who's doing a lot of research on that subject and is also able to get funding for that. So I think it's really improving. And also, like the last year, there were lots of there is always a national training for neurologists, and I gave a lecture there on functional movement disorders, and that then you notice that people are much more aware, and also which is good for the patient, much more positive about functional movement disorder. So to recognize it, to try to find good treatment for patients. But I must say, on the other hand, what's still lacking is good places for treatment options. We have done a symposium for physiotherapists, and we had Glenn Nielsen coming here from the UK. And we had a wonderful meeting, and we had like 100 physiotherapists from all over the country. And I think that was really great because they learned a lot that day and they really enjoyed it, and they're also keen on extending that. But that's only the physiotherapists, but I think it's a good start. So
Yeah.
I think it's coming, but it's like for rehabilitation services, it's still quite difficult to get people there for treatment. So we are working on it, but it's not easy.
Yeah, and from your own work, are you seeing more benefit for patients when it is part of a multidisciplinary team? Obviously movement disorders can be treated just with physiotherapy to a certain extent, but when you involve psychologists, occupational therapists, neurologists, you've just got much more that can be brought to the patient. Is that what your experience is showing?
Yeah, but as I said, that's hard to realize to have this multidisciplinary approach because I do a lot of explanation to the patients. I try to help them with doing certain exercises, and I connect them to a good physiotherapist. But this sort of multidisciplinary approach from different angles at the same time, that's still hard to realize. But sometimes people are accepted at rehabilitation centers, and then well, some benefit from it and some don't. I think it would be very good to do research to see on forehand which patients will benefit most from it, because that will also sort of make the rehabilitation center more actively involved if they have the feeling they're improving the patients.
Yeah.
But it's tough.
Yeah.
I think with the physiotherapist we came quite a long way now, which is good, but there is still a lot of work to do for the other medical and paramedical treatments. But what like I said, what we did this study with the website, and although we don't have the results yet, it was very positively received by the patient that there was on this website explanation, but also how do I discuss it with my with work, with my family, and there were also exercises on it. So it was very well appreciated. If it helped, I don't know yet, but I think that's a very good sort of general first step.
And that's the neurosymptoms.org website of John Stone.
Well, yes, but we made a Dutch one based on that and more focused on movement disorders. So yeah, and if we finish the study, we will put it online and also try to translate it to other languages.
Oh, that would be a fantastic tool then. Yeah. Absolutely. A question here from Bernadette. She said, suppose budget would not be an issue. What more research would you like to conduct on FND?
Sorry, what was your first line? I didn't hear it. What if?
Suppose budget is not an issue. What research would you like to conduct on FND?
Well, let me think about that one. I tend to say I would like to do more focused on treatment and also on implantation of things known already. Like I said, the physiotherapy or multidisciplinary. I would use it for an implementation study to try to get more awareness in, like I said, rehabilitation centers and more, and then test if that's helpful, yes or no. I think I would go for that to get more broad field and that more people are involved in this research area and also in this patient area. I think that would be an important step.
Yeah, and for the Netherlands, the creation of the multidisciplinary teams that the research that you would like to do might provide the evidence for. At the moment, where are most of the services held? Are they in Amsterdam or are they in other regional parts of the Netherlands? Because I know it's difficult for people sometimes to travel from Amsterdam if it's in the southeast of or the southwest of the Netherlands.
Well, I think there is one big center around Utrecht, which is called Zeist. It's a smaller city close to Utrecht. And there are some rehabilitation centers over the country. There is one here in the north, in Friesland. There is one close to Amsterdam. And there is one close to Nijmegen. Those are the ones I know they're really involved. So there are about 4 or 5 centers in different areas of the Netherlands.
Okay.
But this one close to Utrecht is really focused on it. That's specifically for this.
Right. Okay. But which is obviously very, very useful to know. Another question here. This is from an anonymous attendee. They've asked, what is the testing process to get diagnosed? I've had an MRI, EEG, and more.
Well, that's a tough question because I think there are two ways to approach a functional disorder, and I'm more in favor of the one looking for positive signs. So similar, like if you look for Parkinson's disease, for example, you look for certain signs and symptoms that fit with Parkinson's disease, and then you make, based on the clinic, a diagnosis. And I think one neurologist should do the same for functional neurological disorders. You find symptoms that are specific for functional disorders and you make the diagnosis. What happens a lot is that people get a lot of diagnostic tests and then doctors say, okay, it's all normal, so I don't know, or it might be a functional neurological disorder. And that leaves a lot of patients with a very uncomfortable feeling because then you think they haven't looked enough and they haven't done enough tests. So I'm more in favor of turning it around, not doing as much tests as you can, but also doing tests that are positive. Like we're doing a lot of EMG testing if patients like have a tremor or jerks, and see if the characteristics of those tests fit with a functional movement disorder.
Yeah, yeah, and I think it's important, isn't it, for patients to be aware that FND is a diagnosis that can be made with, with positive signs.
And I think for what I've noticed over time is that patients are much more, well, it makes them much more confident about the diagnosis. Otherwise, it feels like, well, I don't have this, and that. And that makes you feel very insecure. That's at least my clinical experience.
Yeah, yeah. Got a comment here from Amy on the Facebook page, and also Audrey on the chat has made a comment, and I think these are kind of related in some aspects. But what Amy has said, and I'm just trying to summarize a little bit what she's written here.
Yeah.
But she's been doing physio for 3 years, seeing a psychologist. She's trying to walk. So basically working through a fairly detailed rehabilitation. I'm trying to keep positive, but still finding that she's getting worse. And Audrey's made the comment about mindset helping to improve things, and trying to battle through just with a strong mindset. In the patients that you see, where people have a positive outlook but still find themselves getting worse, mm-hmm. how do you help them through that difficult time?
Oh, that's difficult, like you said. It's very frustrating if you're really doing everything you can with the help of, like you said, a physiotherapist or a psychologist, and it doesn't get better. Unfortunately, we know from studies that not all functional neurological disorders improve by treatment. So we are aware of that, but we haven't solved that problem yet as knowing what's the next step. And about what you said about mindset, well, I always, I think for me, it's similar to patients who have, for example, multiple sclerosis or other neurological disorders. Sometimes as a doctor, you're not able to make someone better, and you can just be understanding and trying to help to support them in other ways. And not pretending that you always know the question. And I think that's similar for FND patients. At some point, it's hard for a doctor to find a solution if you have tried all the possible treatments. So Is that an answer?
Yeah, no, it is, and I think, and to be fair to the doctors as well, they're only human, aren't they? So
Yeah.
I think if they're faced with a situation that they don't know what the answer is, then the human side will go, well, I'm expected to have an answer, therefore I will do what I can, but I can't do anything more.
Yeah.
Yeah, yeah.
Well, what I always do discuss with FND patients, um, that if what I've noticed over time, that I think the first major step is that you agree with the diagnosis, because that is sometimes troublesome in treatment um, options, that if you're not really convinced that it's a functional neurological disorder, but still think there might be something else, then it's usually very hard to treat. So I think that's an important first step. But then, as I said, if you have tried everything, today I also saw a patient who had tried everything, like you said, physiotherapy for a few years and a psychologist, um, but it just didn't help, and he was very um, well, he was very worried about what was coming next, and I can understand that, and I can't say how it will go. But we also know that it can fluctuate. That by some periods it can get better. So, but for a doctor, it's not always possible to predict how it will go for an individual patient.
No, no, very true. We have a question here from Joni. Well, actually, Joni and I think her sister Hilly. We have a question about how to react on movements. For example, during exertion, getting tremors or other symptoms, is it better to try to walk and to stay exercising, or is it better to give your muscles a rest?
Yeah, that's many times a question. Um, I tend to say it's better to keep moving and not excessively, because I think it's good um, for everyone in general to have to have as good as possible your what's the word, well, that you have how do you call it, when you're well in shape, like you're doing regular exercises.
Oh, fit, physically fit.
Yeah,
Yeah,
because I think then your condition in your general health is better, and you can handle better if things are not going so well. So what I usually recommend is to do not excessively, but just basic exercises, and on moment that you do have the tremor, if you move a lot, that you keep moving but not excessively, and then you at specific times take your rest, but don't let it always, as soon as you move and you have involuntary movements, let it put you backwards, because then it's very demotivating. So I tend to say not to take rest all the time, but at specific moments, and keep doing a bit of exercises. Is that an answer?
yeah, no, no,
Yeah.
absolutely. And just another answer to Joni as well. She's asked if this is going to be available on the internet afterwards, and it will be. So you will be able to look at this webinar afterwards. Question here. This one's anonymous. Do you work with any other doctors internationally? This person lives in Israel, and can't find anybody that knows about FND. And I know this is not a problem that's just isolated to one country. It happens with a lot of different countries.
Yeah.
But what's your experience with the international community that is treating FND?
Well, I think that there is actually, I can only speak on the movement disorder side because that's my field. Um, but I do know that on international conferences, there is a lot of interest from many different countries for patients with functional movement disorders. And I think it's one of the the fastest growing areas where there is an interest in, and also there is always a specific meeting on it during the big movement disorder society meeting. So I think I know in many countries neurologists who are specifically interested in functional movement disorders. But I'm trying to figure if I know someone in Israel, but not directly. But
Yeah.
in many European, but also Australian and also the US, there are a lot of doctors very interested. And we had a wonderful meeting that was organized in Edinburgh in September last year, and it was loaded with people, both neurologists, psychiatrists, but also a lot of physiotherapists. So there was a lot of interest. So there must be people in Israel as well.
Yeah, yeah. It's keep looking, I think, is all that we can suggest at this point in time. And if there's anything else that we can do, we will certainly let you know. But yeah, finding consultants in a particular country is challenging. We have 10 minutes left on this webinar, so if you have more questions, please get them through as soon as you can. Another question here for you, Marina. This one from Amy. She's finding that her symptoms flare up in the cold and with temperature changes. Is this something that you've seen in movement disorders regularly?
Not specifically, but there are definitely patients who have more complaints in certain conditions. Some are doing better in a warm environment, but it seems that Amy is more doing better in a cold environment. I think that's a very personal experience that differs per patient, but there are definitely people who have more or just less complaints in certain circumstances. That's true, but I'm not aware of a very consistent um,
Pattern, yeah.
Yeah.
Yeah. Okay. Another anonymous question here. What are the positive signs of FND?
Well, the positive signs, for example, um, if you have like jerky movements or a tremor, that if you make a tremor yourself with another limb, that the tremor frequency changes and goes together with your voluntary movement. That's a positive sign. Another positive sign is that if you have like a jerky or tremorous movement with one hand and you do something with your other hand, it disappears, so it goes away. And another one is that if you make voluntary movements with your hands, like opening and closing your fingers and your thumb, that it's going very slowly. If you look at it, well, if you like put on your shoes, you can do it very rapidly. So there is a discrepancy between doing movements automatically, then they go right. And when you do them on purpose, so you want to make a specific movement or doing a specific activity, then it goes much more difficult. So those are positive signs that really fit with FND.
Yeah. Okay. Great answer. I hope that's helpful. Sarah's just come back. She's just given her experience about being in the cold because she lives in Canada, where it's often very cold.
Yeah.
But she suffers from tremors and movement disorders. She's found that when she's shivering whilst walking, it will throw her off. So she makes sure that she wraps up warm so that she doesn't shiver while she's walking. So a helpful tip there. But okay. Another question here, and this is from Audrey, and she's asked, do you have diabetes type 1 factored into your research?
If that's a specific area, you mean? If that's
or a factor that you've included in the analysis of your research?
No. In my experience, I haven't seen high numbers of diabetes in the patients I've seen over the last years. It hasn't been there have been patients with diabetes, but not more than in the general population. So that hasn't had a big focus of me, no.
Yeah. And do you see any other comorbidities with the movement disorders that might have an effect?
Yeah, what we have also in this, like I said, in this big study that we performed for the websites, for this website study, we asked patients lots of things with questionnaires. And what we noticed that many patients also suffer from pain. There is a lot of pain problems, and many people are very tired. So that's another complaint that is that's quite a and that has a lot of impact on patients' life. So those are two things that I think are coming along with FND a lot.
Yeah, yeah. We're just about coming to the end, so I'll just remind people if they've got any more questions, just to fire them through quickly now. Another one from Joni here. She's asked, is going to the sauna helping for this disorder, or any other form of water, be it hydrotherapy or just swimming?
I think in general there is not much that is harmful. I think if you like the sauna, there is absolutely no reason why you shouldn't go there. But as you just said, some people like the cold and other one like the warm. So it depends on your personal preferences, what you like and what makes you feel better. So I think if you like the sauna and you feel that it's doing well to you, there is no reason why not doing that. But it's not a specific recommendation.
Yeah, and Cameron here has just asked, he's been advised to keep running as well, and I guess the same message. If you enjoy it and you can do it, then you know, even if you do find it hard to walk, but you can run, then you're not going to
do it. Yeah.
Do it. Yeah. Bernadette, she was one of the participants in the website, the Dutch website trial.
Oh, really? Yeah.
Yeah. So she just asked, when will it be live?
I hope soon. We have included the final patients and we are currently analyzing it. And as soon as we have the results, we will put it live as soon as we can. But we think we have to sort of professionalize it a little bit before we put it online so many people can just freely attend it. So I hope after summer.
Okay. Couple more questions here. Leanne has said, her spasms and flailing limbs wake me up in the middle of the night with a bang. Any suggestions for why this would happen?
No, I don't know. It's that's hard, such a specific question. No, that's difficult to give a specific
reason. Yeah,
reason.
It's not unusual, is it, for people to experience symptoms even whilst they're asleep?
Yeah, I think I noticed that when we ask patients if they can show me a video, because some people have like attacks of involuntary movements, and I've noticed that quite some of the patients then send me videos while they're in bed. So it's something that comes quite often, also during the night. That's absolutely so. Yeah.
Yeah. And then our last question before we wrap up, Claire has, again, this is a little bit specific, so understand if you can't answer. I've noticed a dry throat in the mornings and my muscles kind of collapse in my throat when I lie down. I think I have started snoring and always seem to have phlegm in the back of my throat. This is new since I've been unwell. Is that a possible symptom or unrelated?
Oh, I can read it here. Let me have notes on dry throat. My muscles kind of collapse. It's most likely part of the FND if I read it like this, but it's always, like you said, hard to be specific on one single if I don't see the patient myself.
Yeah. So I think for Claire, if it continues for much longer, obviously it could be related to your illness, in which case you should go and see your GP first of all and get them to.
And I think I just want to make a comment in general. I think if you have functional neurological disorder, you can also have something else, right? So it doesn't rule out everything else. So if you are worried about something as a new symptom or problem, you should definitely discuss it with your GP before thinking yourself always this is FND, because people can have more than one thing. So I think you should always be aware of that.
Yeah, no, great advice. Well, Marina, I think that brings us to a close. I'm really, really grateful for giving up your time this afternoon to talk to us. It's been really informative. I have one last question to put to you, and that is to ask, as an organisation, FND Hope, you understand what it is that we do and how we support patients and work professionals like yourself. But is there anything extra that the patients or ourselves could be doing to help improve the situation in the Netherlands?
I didn't hear the last word. To help the situation?
In the Netherlands.
In the Netherlands. Well, I think what would help is that we last year organized here in Groningen a patient day for rare disorders and also for functional movement disorders. And I think the patients were trying to set up like a patient organization. And well, perhaps you can help them, because I think that's very valuable also to sort of get also from the patient side more pressure on getting treatment options available in the Netherlands. So I think that would be very helpful.
No, thank you very much. Again, thank you so much for your time. Thanks to all of our participants and for the great questions that you've asked. And on that note, we shall say goodbye.
Thank you so much. Okay, bye-bye.